Hello everyone, and welcome back to MediInsights, your trusted source for clear and reliable medical information. In today's video, we'll dive into Topotecan Injection, exploring its uses, dosage, mechanism of action, side effects, and essential advice you need to know. Use of Topotecan Injection. Topotecan Injection is a chemotherapy medication primarily used to treat certain types of cancer. It is commonly prescribed for ovarian cancer, especially in patients with metastatic ovarian cancer, when the disease has progressed after initial chemotherapy. It is also recommended for small cell lung cancer, particularly for patients whose cancer has relapsed or worsened after initial treatment. In addition, Topotecan is used for cervical cancer in combination with cisplatin. It is given to patients with recurrent, persistent, or metastatic cervical cancer. Topotecan works by slowing or stopping the growth of cancer cells, making it a valuable option in advanced or resistant cases of cancer. Next, dosage of Topotecan injection. The dosage of Topotecan injection varies based on the type of cancer, the patient's body surface area, and overall health condition. It is a prescription-only medication and must always be administered by a doctor in a clinical setting. Always follow your oncologist's recommendations for personalized dosing. Here are some general guidelines. For ovarian cancer and small cell lung cancer, the recommended dose is 1.5 milligrams per square meter of body surface area per day. It is usually given as a 30-minute intravenous infusion for 5 consecutive days, and this cycle is repeated every 21 days. For cervical cancer, when combined with cisplatin, the recommended dose is 0.75 milligrams per square meter of body surface area per day. It is given intravenously over 30 minutes for 3 consecutive days, starting on day 1 of a 21-day cycle. Doses may need to be reduced if the patient experiences severe bone marrow suppression or other significant side effects. Kidney function also plays an important role, and dosage adjustments are required for patients with reduced kidney function. Next, mechanism of action of Topotecan injection. Topotecan belongs to a class of drugs known as topoisomerase I inhibitors. Its mechanism works by targeting an enzyme called topoisomerase I, which helps unwind DNA strands during cell replication. Topotecan binds to the topoisomerase I DNA complex, preventing the proper religation or rejoining of DNA strands. This causes DNA damage, which disrupts cancer cell replication and ultimately leads to cell death. This mechanism effectively slows tumor growth and helps shrink tumors over time. Next, side effects of Topotecan injection. Like most chemotherapy drugs, Topotecan injection can cause a range of side effects. Common side effects include bone marrow suppression, which reduces white blood cells, red blood cells, and platelets, increasing the risk of infections, anemia, and bleeding. Other common side effects are nausea, vomiting, diarrhea, fatigue, and hair loss, also known as alopecia. There are also some serious side effects. These can include severe infections due to low white blood cell counts and severe bleeding caused by low platelet counts. In rare cases, it can cause interstitial lung disease, which involves inflammation or scarring in the lungs. Severe diarrhea can also occur, which may lead to dehydration if not properly managed. Because of these risks, regular blood tests are essential to monitor blood counts and check organ function. It's also important to seek immediate medical attention if you develop fever, unexplained bruising, persistent diarrhea, or difficulty breathing. Next, important advice for using Topotecan injection. Topotecan injection should only be administered in a medical setting by a trained healthcare professional in a hospital or a specialized cancer clinic. Because it lowers immunity, take extra infection precautions. Avoid crowded places, stay away from sick individuals, and follow good hygiene practices. Nutritional care is also important. Eating a balanced diet can help support recovery and may reduce nausea. It's also crucial to stay hydrated, especially if you experience vomiting or diarrhea. If you notice symptoms such as fever, unusual bleeding, breathing problems, or severe diarrhea, report them to your doctor immediately. Regular monitoring is necessary, so you will need frequent blood tests and checks on your kidney function throughout treatment. Topotecan should be avoided during pregnancy and breastfeeding, as it can harm the baby. If you are of childbearing potential, Your doctor will recommend effective birth control during treatment and for a certain period after treatment ends to ensure safety. By the end of this video, we hope you have a clear understanding of Topotecan injection, its uses, dosage, side effects, and precautions. Don't forget to like, share, and stay tuned to MediInsights for more trusted medical content. See you next time.